Assalamu alaikum, the communication day. First scenario, Mrs. Hala, 35 years old, has been diagnosed as a case of systemic lupus erythematosus. 3 years ago, recently, she has been complaining of eye puffiness, morning eye puffiness, and fourth urine. 24-year routine done for her, and the diagnosis of nephrotic syndrome has been confirmed. The nephrology consultant decided to do renal biopsy to know the staging of her kidney involvement to start the proper treatment. You are the senior officer in the nephrology department on call today. You are asked to discuss the issue with her. If you are ready, Dr. Ahmed Chata, we can start in a second. Just the timer sharing. Yes, here you go.
Okay, hello, I'm Dr. Ahmed from the medical department. May I confirm that you are Mrs. Hala, 35-year-old?
Yes, I am.
Hello, Mrs. Hala. It came to my knowledge that you have been complaining about eye puffiness and some froth urine. Can you tell me more about that?
Actually, I was diagnosed with a disease named as systemic lupus erythematosus 3 years back.
Mhm.
My rheumatology doctor noticed that I have this buffness in the last visit. So he has done for me a test on my urine and discovered that I have nephritic syndrome. He told me like this, but still I am confused regarding my diagnosis.
I see, Mrs. Hala. Actually, after we have made some investigations and some labs for your urine, the results didn't come as we hope.
What do you mean, doctor?
Regarding your condition of systemic lupus erythematosus, this condition is actually a defense immune system disorder that may, instead of attacking bugs and germs, may attack your heart or kidney or brain or other organs. Are you following with me?
Yes, I am worried regarding.
And after checking your labs, the kidney consultant decided to make a snip from your kidney to be sure about your diagnosis about this disease affecting your kidney. Can
What
you
do you mean by
understand?
snip, doctor? You will injure me?
I see. I appreciate your concern, Mrs. Hala. Let me explain more. Regarding this snip from the kidney, it's actually a procedure that will be done in a camera imaging unit test. This is like we insert a syringe, a mini procedure after giving you some numbing to make you relaxed or to make this area not painful. Under imaging, we insert this syringe to take a small snip of the kidney to allow for confirming our diagnosis. Are you following with me this?
I am following you really, but I'm afraid if there is any complication of this procedure can occur to me.
I really appreciate your concern, Mrs. Hala. This procedure, like any other procedure, of course, has some disadvantage or some complication, which may cause some bleeding or some infection, or maybe the snip inappropriate to get through the kidney. But in order for confirming your diagnosis, it's it have to be performed to confirm your diagnosis, and the benefits outweigh the risks of the procedure.
What complication can occur to me, doctor? You mean there is complication and the benefit and the risk? I'm still confused. There is complication can occur me other than my disease?
Like I've said, Ms. Hala, this is a procedure that has side effects like any procedure. Maybe some bleeding may occur or some infection. But in order to get the best diagnosis or confirm your diagnosis, it is the only option to get a snip from your kidney to be sure of the diagnosis and to give you the further management plan for it. Can you
There
know?
is no other alternative, doctor? No other imaging or anything you can do to confirm what I have in my kidney?
I'm very sorry to tell you that this is the only option to confirm your diagnosis.
But I am
And
afraid to do this procedure already.
I appreciate your concern. This procedure is to be done under complete aseptic condition and with an expert doctor who have done this procedure before without any complications. Uh, and of course, there is something you have to give us a written consent for this procedure to be done with all the advantages and disadvantages of the procedure written in the consent. Are you okay with that?
You mean an agreement?
Agreement. Yes.
Yes. I will think regarding this issue. But doctor, I have many questions to ask regarding my disease because now I am 3 years and they are treating me. There is no cure for my disease.
You mean the systemic lupus erythematosus? This disease,
Yes.
as I said, is immune system, immune defense disorder that that instead of attacking bugs, it attack many organs in your body. We can manage this disease. It is manageable, but it is not completely curable. I'm so sorry to tell you this news.
It means that I will still suffering all my life. You mean this?
We will give you, of course, all the support and all the management you have, but and we also can manage any complications that happen from this disease. Does it make any sense
Really,
for you?
I am so sad and depressed regarding what you are telling me. Can I get pregnant? Because now I married since 4 years and no pregnancy occurred. I am planning to be pregnant. What is your opinion, doctor?
Uh, is there any history of abortion?
I don't have history of abortion because no pregnancy already occurred.
No pregnancy occurred. Of course, we can refer you to woman doctor regarding that, but also uh, uh, we could manage first your kidney issue. This is I won't say that it is more important or it is, and then we can refer you to woman doctor in regarding this concern.
Okay.
And also we will involve a joint doctor to. انا حاسس انها كده قلبت لونج كلينيكال اكتر.
مم. لا مش لونج كلينيكال يا باشا، كمل.
تمام. آه، بس I
So
will
I
summarize.
want some time to think about this procedure, okay,
Mhm.
and to ask or search for other maneuver because I
Two
am
minutes
suspecting
left.
that I can go normal after this procedure.
I'm sorry. Sorry, I can't understand. You mean you would ask someone about this procedure?
Yes, I am suspecting that any complication can occur to me also.
Uh, I appreciate your concern.
Still, I'm not convinced.
Mhm.
Still, I'm
I,
not convinced.
I really appreciate your concern. This is a mini procedure that it will be done by expert doctor which have done this procedure many times without complication. It may have some side effects like some bleeding or some infection, but we can manage this complication if it occurs also.
Okay, doctor, thank you really.
You're welcome. Okay, to summarize the case, we have talked about your disease, about systemic lupus.
He, he told me that I have kidney affection, and there is a snip to be taken from my kidney. And after this, you will decide regarding my treatment.
Mhm.
And also, I should sign a consent agreement for doing this procedure. And regarding my disease will not be cured. Also, regarding pregnancy, you will refer me to the woman doctor.
Yes, yes. Thank you so much.
Thank you.
I will also give you some brochures and leaflets and our contact number for our department.
Perfect.
Okay.
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 Time's
Thank
up.
you.
Time's up, Dr. Ahmed. Thank you, Dr. Ahmed, for taking the case.
Thank you.
You're welcome.
Thank you, Dr. Ahmed,
Maybe
for
it's
the.
my third or fourth time to make communication case, and I'm entering the next diet, which is at 24th of May. So I'm a bit anxious also.
No worry. You did perfect, by the way. You're confident, and the point you raised, it's accepted. But don't stop in the middle for any reason. Okay.
Mhm.
Regarding history taking, I will address all this after Dr. Ahmed Abdelakhir comment. I will tell you the advice about this. Okay.
Okay. Oh, excellent, doctor. The excellent news that you are not using jargons. You avoided the jargon. This is important. This is excellent. But there is some issues you forget. The social history is important.
I
Okay.
forgot
You
it.
should,
Yes.
this is important. You should ask regarding the job if there is financial support. This is very important. Okay. Other thing regarding the pregnancy, it is risky because now the disease is advanced. Now going to the kidney, so it is advanced.
Mm.
So mostly you can answer me. It is risky. However, also I will refer you to the woman doctor, and it will be multidisciplinary decision also with the joint doctor, the main treating doctor. I think the joint doctor. Okay,
Yes. Yes, of course.
okay, because she will receive immunosuppressant drugs mostly.
Mm.
According to the biopsy of the kidney, it will appear. Okay.
Mhm.
Important fluency is good. May you are stressed some يعني fluency should be more than this. يعني don't be hesitated. I think it should be fluent more than this because of the stress. The stress also in the examination will be more.
More. Yes.
Yes. Also, I'm advising myself also. I will be like you, if like this. I will be also sometimes my fluency is affected by the stress. We should be more fluent because if we'll be hesitated, even you are answering well. You answered all things even before I asking you. You answered all. Only the missing part is the social history.
Socially.
This is important.
Mhm.
Okay. The disadvantage of the procedure you told regarding. You should also tell regarding the advantage of the procedure you told. This is the only way to make sure regarding the stage of your kidney condition to decide what the treatment further would occur. The consent is important that you have not forget the consent, because if you forget this is important. Also, you mentioned regarding the definition of the systemic lupus. It is a multi-system disease due to disturbance of a defense system, and instead of attacking the germs, it will affect your joints and other body organs. This is important. Okay.
Mm.
On the start of the meeting, you told me, can you tell me more about
What about that?
this? Yes, it's okay, but I think they are using more in the long cases more than يعني you can tell how much do you know
How
regarding your
much
condition.
can I
Yes,
know what information you have about your condition, or can
yes,
you
yes.
tell me what kind of? Mhm.
Yes, better, I think, because how much can you tell me more about that? This is a symptom or something like that one, and you are making further analysis of this complaint on the long case. But all يعني you are excellent. It's okay. يعني very good, yeah. Alhamdulillah.
Okay, thank you, Dr. Ahmed. Please prepare the scenario, Dr. Ahmed Shetta, and I will comment now. As Dr. Ahmed commented on the introduction, yeah, what's your idea about your disease? Can you tell me more? What do you know so far about your condition and the expectation? Of course, this is as introduction for any counseling about disease. Then you have to ask here, do you know about systemic lupus erythematosus, or you want me to explain more? Why? Because I will waste 2 to 3 minutes explaining something she might know everything about, and I don't need to explain all these things. Okay, so ask her this question. Do you know or you want me to explain? Please explain. You will do it in breaking bad news because maybe she doesn't know anything. If she's diagnosed and she knows, no need to break bad news. Just explain the procedure. And as any procedure, please draw. Try to draw in your paper. In our meeting, you can draw on the screen. Just to show here, this is the kidney. We are going to put a needle, small needle. It will not hurt. However, we will try to make the complication very few. It will be done by clever and expert doctor. They have done this procedure many times. The complication very minimal compared to the benefit. The benefit always outweigh the risk. Although there is risk as any procedure, are you understanding me? Are you following me? As you did, you have the skeleton and the scheme of doing communication properly. But
Mhm.
some points, I don't want you to be stuck. Like, I don't
By
want to.
practice, you mean?
Yes, so of course, by practice, it will be much better and solved. Let's finish the procedure as we know, during and before and after. Before the consent and preparation, any blood thinning medication, please stop it because most of SLE patient might be on anticoagulant for antiphospholipid antibody syndrome. So here, please, you have to ask for any blood thinning medication. Even if you don't want to take it as a history taken, you can say, we have to be sure that you are not on in any blood thinner medication. She will tell you, doctor, I am on. So please, we will arrange with you how to stop and how to hold this medicine before the procedure, and we will address this concern with the meeting. Because this is not your consent today, but you have to be sure that there is no blood thinning medication. Finish this part, the consent form. Of course, before doing any procedure, we have a form called consent. You have to read it carefully and to sign it. And please, if you change your mind anytime, you can withdraw. This is before. Uh, During, you might be admitted in a unit called daycare unit. It will be for 1 day or 2 day maximum. We will be sending some blood tests and blood workup to be sure the bleeding and the blood is okay before doing this procedure. And the procedure will be done under technique which will be very clean by cleaning the area using scan camera, as you said, but it's not camera, it's scan. Doing a scan through your skin to know where exactly we can take the snip without harming other organs. Then after that, we will be sure that you don't have complication like bleeding, like bleeding only, and or injury to other organs, because infection might happen later. It's not, but it might happen. So we will be sure that you don't have any bleeding. We will monitor you for a couple of hours. Don't mention, day or 6 hours or 12 hours, whatever. But you can say a couple of hours will be under monitoring. If everything is okay, this is the time for after procedure. What after procedure? We can drive you home if you don't have someone to take you. We can arrange for you some follow-up appointment to have a look for your result and to inform you about the next plan. By the way, the SNP is not to diagnose SLE. SNP is to put a stage for her kidney disease. You said we will,
Yes, I know.
yeah, but you said we will confirm the diagnosis. No, it's confirming the stage of
Mhm.
your kidney.
ده ممكن يعني I was in my mind. I was thinking about, of course, the kidney, but I don't tell the patient itself that we will diagnose your kidney stage or kidney disease.
But I remember you said for the diagnosis. Anyway, it's
Yes,
for the
I
staging.
said from the diagnosis.
Okay.
I said it loudly. Yes, yes.
Yeah. So it should be for the staging, and according to the staging, we will give you that management plan accordingly and appropriately. Finish
Uh,
this part. Now you will address other social and occupational. The most important, the job. If she told you her job is affecting, you have to know the job. If she said something related, you can ask her what's the impact of this in your job. Yes, doctor, I am driver. I am taxi driver. If she said I am driver, it's good. Why? Because you address two things in one, the driving and the job. But if she didn't tell you I am a driver and her job is affected, you can provide her sick leave because after procedure, the patient should take rest. So you'll provide sick leave. For the driving, you have to address the driving. Please, are you following with the DVLA? Why, doctor? Because sometimes this disease might having or SLE doesn't have, right? I'm talking about MS. Sorry. So SLE, no driving issue unless there is something in the brain. SLE cerebritis, for example. But otherwise, no, there is also some scleritis. And anyway, if she has any vision problem, you can ask her also, do you drive? Yes. Do you think this driving affected by the disease? No, doctor, I don't have any impact on the driving by this disease. Then the time for smoking, alcohol. Do you smoke? Do you drink alcohol? Address both of them. And pregnancy is very important. She raised it by herself. That's good. What to advise? By the way, the pregnancy, you don't have any information that it is risky or not risky. And you are not the ones to decide or to judge on the pregnancy with her. So you refer her to the woman doctor to tell her is it risky or not. Yes, it should be planned pregnancy, but you cannot say it's risky to have a pregnancy. No, it should be planned pregnancy followed by the woman doctor and to be having a safe baby and to be also safe from the complication of SLE. We know that SLE, whenever the patient is having SLE, the pregnancy worsens the symptoms, yes, but the pregnancy itself can be safe unless she has antiphospholipid
But
syndrome
at
positive.
kidney affection, Dr. Bassem, they advise to postpone because the medication required for this problem
Yeah.
will not allowed in pregnancy. So we will
So,
advise to postpone any kidney affection SLE. You should advise to postpone the pregnancy.
okay, but you can tell also pregnancy doctor will follow with you and will give you a follow-up program to have a safe pregnancy. Whenever the pregnancy will happen, we don't know. Is it
But
now?
it
Is
is
it
clearly written in this scenario that to advise if she raise this concern or you should raise it.
so we can say clearly postpone your pregnancy like this, or I will tell her,
Yes,
I will
because
refer
the
you
kidney affection in SLE, all the medication required is not allowed in pregnancy, and this will be a problem. So you
teratogenic.
should be a safe doctor and advise her that you will require some medication in this at this stage. So
But we
please,
don't know still the stage. Yes, I agree with you. But if I say I will refer you to the woman doctor to address this point and to give
maybe
you,
yes, maybe.
yeah. Anyway, it's not safe to let her without asking the pregnancy plan. Okay, better to refer. And as Dr. Aisha said, if there is some medication, we don't know the stage yet. So the best thing is to postpone or to refer her to the woman doctor to have safe baby and safe pregnancy. This is the way how to address the pregnancy for any scenario, not only this. Refer to the woman doctor. Okay, this is regarding the whole scenario. I think we covered most of the point. The consent form again, you can read it. Please read it again. Brochures, leaflet about the renal biopsy, the procedure. Any inquiry, you can contact us. This is the contact number of our department for any inquiry. Okay. Any comment or question by others? Postpone
Thanks.
as Dr. Aish. Okay, thank you, Dr. Ahmed. Did you prepare a scenario?
Musir, maybe I'll take one.
Sorry.
Okay, I prepared one.
Okay, send me this scenario, please, or send it to the chat box. Yeah, the point of depression, when she said to you, I'm so depressed about this news, again, be sympathetic. Say, sorry, I'm so sorry for your feeling. I know this is very frustrating news for you, but be sure, whenever you give bad news, assure, be sure, we will not leave you alone in this journey. We will be supporting you, we'll be aside you or beside you all this journey to give you the maximum support and care you need to make the complication very low or very few, okay, or minimal. However, this disease is not curable, as you said exactly, Dr. Ahmed Shata. You said it clearly. It's not curable disease. However, we are trying to make the relapse less than expected because every patient with SLE, they had a lot of relapse, flare up, and sometimes renal, sometimes central, skin rash. But please don't ask as a question. Do you have any missed pregnancy? You can say as advice, if you have or if you had before any missed pregnancy, please let us know to arrange with you a meeting with our woman doctor in this way. So avoid questioning, but give it as advice. Okay? That's why you felt yourself taking history. I don't need from you to ask questions as taking history. You can ask about history of alcohol, smoking, driving, job. Are you planning for pregnancy? That's more than enough to ask about. If she said, I am, yes, doctor, planning, I'm worried about planning. So I have some of problem in my pregnancy, or I wish to be pregnant. So simply, yes, in case you have any problem with your pregnancy before, please let us know to arrange a meeting with our doctor. Don't ask her more than this.
Yes, Dr. Bass.
Okay. Dr. Aisha again wrote, or she wrote, as treatment of kidney infection will require medication not suitable for. Yes, agree for any patient will take medication lifelong, like antiphospholipid also, like mitral stenosis, anticoagulant, like MS, multiple sclerosis. Yes, we have to be cautious with the pregnancy and the teratogenic epilepsy as well. Supposed to postpone the pregnancy until the patient will be followed by a woman doctor and the disease will be controlled to have or our aim and all the team aim to have safe pregnancy as well as safe babies. It's not a matter of mother safety only and not a matter of the baby only, safety of the baby only. It's a matter of both of them safeties. Did you send the scenario, Dr. Ahmed?
Um, or
Okay, if they ask you uh, about the capacity, you have to ask the patient what she retained from the meeting. If there is a capacity issue in the scenario, you can ask her at the end what you get from this point or what you get from this meeting to be sure that she gain a lot of information and she's able to understand everything. Okay, the scenario, Mrs. Maha, 40 years old, complain of fatigue and weight gain for 3 weeks. Okay, then this is long or
yes, and to you
no, no,
mean
no.
communication?
Yeah, yes, our rule is to do communication one to one in the same day. So you will give him and he will give you communication. You don't have?
Okay, no, communication easy.
Okay, just tell me
Uh,
the
okay, I'll write it and tell it at the same time. Mrs. Amira is 29 years old. She was admitted 3 days ago as a case of pulmonary embolism. The hematology consultant prescribed warfarin for her in the best interest of her condition. She read about warfarin side effects on the internet and she's very worried about these drugs. You're the
perfect.
SHO medical department. You are asked to discuss this issue with Mrs. Amir.
Perfect. So counsel about warfarin in pulmonary embolism patient. Dr. Ahmed Abdel Akhir, be ready. After 2 minutes, I will try to to write the scenario.
Okay.
Mrs. I prefer to make the patient name away from our doctor's name, so we'll make it Julia, Mrs. Julia Adam, 35 years. Correct me if you feel any mistake. So Mrs. Julia Adams, 35 years, has
3
been
days ago
diagnosed
with pulmonary embolism.
diagnosed with pulmonary embolism
The
since
hematology prescribed warfarin.
index. Hematology decided to start in the best interest. Warfarin for hair in the best interest of hair. Please sit with her and counsel about
Side effects for
the medication and possible side effects, right?
yes.
And possible side effects. Okay, here it is. If you're ready, Dr. Ahmed Abdelakhir, let me know.
Okay.
Any question from others? Sorry for what happened today about Zoom meeting. It's out of control. I think that's why we have less number, maybe the half of our attendees. Any questions for the previous scenario? So we have today scenario, or we had scenario about counsel about the disease. Oh, sorry, procedure. And now we will have a scenario of counseling about the medication. It's very common in the exam procedure counseling or explaining a procedure. You have to be ready. Don't be worried if you have a new procedure. The procedure as a procedure itself and explaining in any kind of procedure. You can explain it like, as I said, during or before, during and after. How to prepare the patient, how it will be done, and the possible complication post-op or post the procedure. And please don't forget about the monitoring, offering someone to drive her home. It would be much good to inform or to offer someone to take this patient home. Social and the job, smoking, alcohol, driving, according to the scenario, and any female in the childbearing period, as we know, we have to ask and counsel about the pregnancy. And if she has delivered recently, you have also to talk about the lactation. Is it clear for all? Procedure is really one of the easy scenario to how to do in the exam. Preferred
How
one.
to talk about lactation, Dr. Basim, you mean?
If she mentioned like she had delivered recently and she might have medication, sorry, lactation for medication, not for if she had she's lactating and she will receive medication. So we can yeah talk about the possibility of the drug to be secreted in the milk. But this is not in the procedure. Sorry, I put it here by mistake. It will be with the medication or counseling about medication. But of course, like our procedure today, the patient will be prescribed medication for the future. So also you can address the pregnancy and the lactation if she had or she will be pregnant. But the pregnancy is the most important. Okay.
I see.
Okay.
Okay.
I think you are ready, Dr. Ahmed Abdelakhir. Let's start.
Yes.
Yes. Here you go.
Hello.
Hello, Mr.
My name is Dr. Ahmed, one of SHO doctors here in the department. Can I confirm that I speak with Mrs. Julie Adams, 35 years?
Yes, Doctor. I'm Mrs. Jolie, 35 years.
Okay, today we are going to discuss some health issues related to your condition. Is that okay with you?
Yes, doctor, it's okay.
How much do you know regarding your condition?
Uh, I was doctor admitted from 3 days, and the doctor told me that I have some blood clot in my lung blood conduit, and one of the blood doctors prescribed for me a drug called warfarin. He said to me it's for thinning of my blood in order to avoid any clots. I'm very worried, doctor, about this drug and what it may cause to me.
Thank you for sharing your information. Actually, as you told, warfarin that used as a blood thinning medication because you have this blood clot. So it is important to be used. It is prescribed by the blood doctor in the best of interest for treatment of your condition. Now, you are following me?
Yes, doctor.
Yes. As a medication, it is safety used and it is safe to use. And as any medication, it has advantages, and also there may be some side effects that we are trying to minimize by following up you. Is that okay with you?
Uh-huh. Yes,
Yes.
doctor, I'm following.
Yes. Sometimes this medication causing bleeding. Sometimes it occur. So we need from you precautions to be done, like if you are practicing sport to avoid this practicing any trauma or needles or anything can injure you, to try to avoid while you are receiving this medication. Is that okay with you? You will,
Okay, doctor.
yes, we will follow you with blood tests. That test called the INR. This test, we will follow this medication is going and making blood thinning of this clot, and its action is accurate and not making you to bleed. So it will be done as a follow-up for you. Okay?
Okay, doctor, I understand. You mean you will check my INR to prevent bleeding, which you said it is a side effect of the drug. You mean that?
Yes, yes, yes. Sometimes it causes some hair loss, but it is rare. So you will be followed, and this treatment is important to be received because this blood clot, it is occurred in a main blood channel. So it is important to treat and not to wait any time of the start. Is that okay with you?
Yes, doctor. Yes, it's okay.
You have any concern, other?
Yes, doctor, I have some concerns. Uh, I just want to understand for how long I'm going to receive this medication, this warfarin.
Actually, because just you started to receive this medication, and this clot in the main trunk, multidisciplinary team will decide regarding the continuation of this medication. It can be lifelong because this is the main trunk of blood. So this clot is important to avoid its occurrence in the future. So it can be lifelong. However, we will sit with my consultant and the multidisciplinary team to decide. But now, because just you start since 3 days, we will continue our medication and we will follow you. Is that okay with you?
Yes, doctor, I understand now. But doctor, is there any alternative drug to use instead of this drug that can cause bleeding, as you say, and can may some have some side effects?
You mean another alternative than warfarin?
Yes, doctor.
Yes, there is other medications can be used. However, the blood doctor decided that this is medication is the best of interest in your condition.
I see. Mhm.
What you are doing for work
I am working as a teacher, doctor.
as a teacher? How much is, this condition is impacting in you? You will give we will give you sick leave because now you are admitted in the hospital. You are receiving this blood thinning. Okay.
Mhm.
So we will give you sick leave. Okay.
Okay, doctor.
Are you a smoker? Are you a smoker?
Yes, doctor. I am smoking.
Smoking also can affect your condition. It is better, highly advisable to stop smoking. If this okay with you, we can also send you to the smoking cessation clinic. Is that okay with you?
Okay, doctor. It's okay.
Are you drinking alcohol?
Yes, doctor. I'm drinking alcohol.
Also, alcohol can affect the medication, its dose in blood and its action. So it is better to stop uh, alcohol or minimize it. I can also refer you to the assigned team regarding this.
Okay, thanks,
Is
doctor.
that okay?
Yes, it's okay.
Okay. Any other concern?
No, doctor.
Okay. Can you summarize what you get today from our meeting?
Actually, I have a bit of concern, a little one.
Okay.
Me and my husband were planning to have a baby soon. Is it okay with that?
Actually, this medication can affect your baby. Okay. Like that one, also I will. We can make participation of the woman doctor. However, now our main concern is your health, so we cannot stop this
Pregnancy.
medication. Even it can affect your baby. So better to delay pregnancy now. However, also I can make you to sit with the woman doctor. Is that okay with you?
Yes, doctor, it's okay. Thank you.
Any other concern?
No, doctor, thank you.
Can you summarize what you get today from our meeting?
Yes, doctor, to summarize, we have talked about my condition, which is blood clot in the main blood channels of the lung. And the blood doctor has prescribed for me a drug which is warfarin. This drug may cause some side effects such as bleeding, and we will follow the INR to prevent these. And also, I have to minimize alcohol and smoking to let the drug work well. And also, if there is any pregnancy, I have to delay it. Planning
Yes.
pregnancy, I have to delay it.
Yes. Thank you. Any other concern?
Thank you, doctor.
Still 30 seconds.
30 seconds.
I'm
Which
going to
concern
give
then?
you some leaflets and websites.
Yes.
Like this.
Yes. Yes. I can provide some leaflets and brochures regarding warfarin so that you can read. Oh, yes. I forgot to tell.
What else?
What else? Hmm, Finished.
Okay, time is up. Dr. Ahmed Shata, please, can you comment?
Yes. Actually, well done. Dr. Ahmed, you you did the case very well. Also, although you forget some things such as diet, that some type of food may alter warfarin effect.
Yes,
Uh,
cranberry, I think.
yes, and grapefruit, and you can refer her to a dietitian. And about pregnancy, you also forget, but I raised it as a consent
Yes.
for the feedback. Um, and you said to delay pregnancy. Actually, there is an alternative, which is low molecular weight heparin. You can say to her that this may be exchanged with another thinner medication taken under the skin to be safe during pregnancy.
The problem that written the scenario in the best of interest, I thought this is the only drug to be taken regarding.
Mhm.
So
This
I
is
have not
also,
even told direct oral anticoagulant or this.
you answered it well when I said to you, is there any alternative, doctor? You answered that we can discuss this with the blood, and he gave it for the best interest of your condition. And you said there is alternative, I think.
Yes, I said to refer to the blood. Yes, blood doctor. Yes,
Yes, yes. You
yes,
can discuss any alternative medication in this concern with her, and there is some alternative medication. But after, like you have said, exactly, after returning back to the blood doctor, we can give you an alternative drug. And also about smoking, it can affect the work of warfarin, the same like alcohol. So
yes,
you, the examiner, I يعني أظن هو هي he will ask about, he will wait for you to ask that smoking, you should stop smoking, that because it affects the drug itself, not only affects her life or her condition, which is pulmonary embolism.
yes, yes.
uh, rest of things you said it very well. No, nothing to raise.
Okay, thank you.
Yes, well done, Dr. Ahmed. Well done.
And also
Uh,
any new medication, sorry for interruption.
yes, yes,
Any new
perfect. Yes.
Yes, any new medication, if you are going to receive any new medication, you have to inform your blood physician, as there is many interaction with warfarin.
Yes, yes. Excellent review.
Yes, exactly. This is one also of the most important advices. It's like red flag as well. You can mention it as advice. Please, if you are planning to start some medication, if you are planning for pregnancy, if you have some exercise to do, it's vigorous exercise, all these things should be explained as red flags. Please try to minimize or to avoid vigorous exercise, the sports, hiking, any hobbies you are preparing to do. Why? Because this patient might go hiking, and if she has any trauma, she might bleed, right? We should talk about these things with any patient taking blood thinning medication, whatever the kind, warfarin or other types. Okay, you can hear me?
Yes,
Okay. One more advice for Dr. Abdul Ahmed Abdul Akhir, particularly regarding inventory. You mentioned it's a blood clot in the blood in the main trunk. Who told
yes,
you this is a
yes.
blood or pulmonary embolism in the main
And
trunk?
the main lung channel, I think I said
Yes.
better.
So don't
Yes,
mention something not mentioned in the scenario. It's a
yes,
big mistake if you say something it's not in the scenario. That's why I wrote it immediately in the chat box. Don't add any details from your side. Whatever
oh,
written in the scenario, stick to them. Okay, this
yes,
is regarding as a counseling. I made the short video for counseling any medication. You have to prescribe, or sorry, the introduction, of course. After introduction, the agenda. I am here to explain and blah blah blah. The indication, and if she doesn't know about the medication and the condition, you have to explain. You have a condition called pulmonary embolism. You heard about it, yes, doctor. They explaining about it. So we are here to discuss about the plan, our management plan to start you on medication. It's called warfarin. Have you ever heard about it? No, doctor, I didn't. So make it in the conversation way. I am asking and she's answering. She can ask, I will answer in this way. So this medication is called warfarin. It's one of the medication make blood more thin to prevent further blood clotting, and it can be taken as or by mouth. It's oral medication, so it can be taken as per mouth. And there is also daily basis dose. And as you said, you have to be followed, and before start the medication, you have to check what is called INR. It's called international ratio for blood thinner. You have to be followed with INR click. Anything you mention, you have to explain it. What is INR? She might ask you, what is INR? Simply say this is international ratio for blood thinner. We are following our patient taking this medicine to be targeted within numbers, average number from 1 to 2, 2 to 3, whatever. Don't mention number also. It's not the task to talk about your target. It's the task to talk about medication and following with the INR clinic and to be in the target INR, whatever the number. Next, the possible complication. As you said, bleeding might happen for minor trauma, or even some scratch might lead to more bleeding. Any procedure, before doing any procedure, to have to explain to your doctor any dentals follow up for any procedure as well. You should inform your doctor that you are taking this medication. Before starting any medication, you have to inform your doctor that you are taking this medication for drug-drug interaction. Now the time for smoker. I prefer to ask, do you smoke, do you drink alcohol? Don't say, are you a smoker, are you alcoholic? Why? Because the question or the nature of the question is not the scientific. So don't say, are you smoker? Do you smoke? Yes. Because there is definition of smoker. There is definition for alcoholic. Alcoholic means a patient taking a number of units per day and he has symptoms of alcoholism. So medically and scientifically, it's not accepted as a question. Do you smoke? Do you drink alcohol? Prefer to try to train on this. And do you drive? Don't say, are you a driver? Okay. This is the best way to answer to ask these questions. The job, of course, you have to ask, and the good thing also you ask about the impact on your job. And please, if she has any issue raised for her job, as you said, you can provide her sick leave, but don't provide without reason. She might go her job, okay. She's admitted now, yes. But if she told you, yeah, doctor, I am now in the hospital, so don't provide sick leave unless she's concerning about that. Because this is acute thing. You can provide sick leave for the admission, but for the further plan, you don't know what might happen. She will start on
So
warfarin. Yeah.
acute admission, they are
Yes,
not providing the sick
need.
leave.
No, they are. It's a must, by the way. But I am talking about warfarin for the future. So you address as PE, right?
Yes.
And the impact of her because she's absent now, so you can provide her sick leave. So it's the same, but try to make it indicated if she asks you.
Okay.
The last thing for the dietary, the diet, yes, the diet interaction is very important. And the smoking, Dr. Ahmad Shatta told you, smoking itself, there is interaction because the inducer, hepatic enzyme inducer, hepatic enzyme inhibitor, either alcoholic or the alcohol or the smoker. You don't know what are the inducer, what are the inhibitor. So you have to refer for smoking cessation clinic. You have to refer to, as you said, to the assigned team of the alcohol nurse to sit with you and to give some advices. She might help you to stop alcohol. This is not the task to talk about alcohol as a drinking, how many units, or should be stopped. But if or she or he drinking exceeding the limit, so we can make it in gradual withdrawal. This is for any alcohol, by the way, for any scenario, not only this scenario. If patient taking alcohol and there is harm, even with minimal amount, you should stop it. Like in this scenario, you have to stop. There is interaction and it might lead to therapeutic INR or subtherapeutic INR, the risk of bleeding or the risk of thrombosis. So please stop it, but stop it in perfect way and proper way. So refer to the team and they will withdraw. Don't stop it suddenly or abruptly by yourself. The last advice, driving, I think no issue for the driving. The hobbies, I mentioned the hobbies. Okay, I will check the dietitian. Trauma, yes, vigorous exercise, I wrote. Sometimes I'm writing here just to remind myself and also to be for you. Red flag, as Dr. Aisha said, alcohol stop. I think just moderate and avoid binge drinker. Yeah, I remember binge drinking, either inducer or inhibitor, and the alcohol itself has the same, either inducer or inhibitor. What I remember, the binge for inducer and the long or the chronic alcohol for inhibitor. If someone can confirm or correct. Anyway, I don't think Dr. Aisha to be moderate because even the moderate will interact. The binge drinker will
They
will
checking the
interact.
INR, Dr. Bassem. If he will moderate, they will provide the INR as he as the normal of him. But
Okay.
I am not hearing anyone to stop the alcohol in patient taking warfarin. So I think it is, if you will decide to stop the alcohol, I think it need to be
Yes.
harmful for him about that. But if he moderates alcohol, you can you every month like follow up the INR and you will provide like calibration according to his eating,
So the
to
I
his
know.
yes, like alcohol. Also, this like the eating, because also the food interact with warfarin. So he will moderate and avoid the binge, because the binge you can't control with
Yes.
it.
Yes, exactly.
But I don't know really. This point, I first time I heard to stop the
Yeah.
alcohol with warfarin. Yeah.
Okay. So at
Sorry, one
least
thing I
yeah.
didn't catch, Dr. Basim. You said
Yes.
don't invent about something with the pulmonary embolism,
Yeah, he
blood
mentioned
tunnel or blood conduit.
this is Dr. Ahmad Shata. Yeah. He mentioned to you this is a blood clot in the main trunk. So I said
Mm-hmm.
to him, don't mention where is the blood clot or the pulmonary embolism. Why you said trunk, although it's not written. You got it?
Okay, okay.
Hello? Sorry, Dr. Ahmad Shata, I received a call. You heard this point?
Yes, yes, I
So
see
don't
it.
say
I get it.
something it's not written. Where is the pulmonary embolism? It's there, but we don't know where exactly. Okay, the last thing, yes, related to the pregnancy. Again,
Maybe you can
uh,
say this is a serious condition and
yes,
warfarin
it might threat the life in second or next if further complicated with another
and
pulmonary
warfarin
embolism.
is vital,
Yeah,
and this drug is vital for such a condition.
yeah, it's very
Mm.
important to start on in the best interest of your condition. For the yes alternative, if not mentioned to you, NOAC or DUAC, don't mention them. You don't know if is it suitable or not. The last point, the duration. You don't know also is it provoked or is unprovoked. Try to be diplomatic in your all answer. So you can say it can be for couple of months, because for any pulmonary embolism, either 3 months or 6 months, you don't know is it provoked or not. Provoked, it will be 3 months. Unprovoked, 6 months. So it would be one of them, and you don't know what the scenario is. So please say couple of months, or to be assessed again to tell you for how long or for the duration. But it will not be less than 3 months, and it will not be lifelong. It could be lifelong, but it's not mandatory to be lifelong. You don't know what the base or the background of this disease or the pulmonary embolism in this condition. Always give frame of time which is not clear. No cut. Maybe 3 months, maybe 6 months, so a couple of months, or for some months until know the cause. You can decide after that. If written 3 months, you can say 3 months. If not written, don't mention. Clear? Okay. I think also the time is late. Any comment, any question? At least we did the scenario, the two scenarios today. I was worried to skip this session. It's very important to follow the schedule. I'm trying to make it in daily basis with the Friday off. So we finish long clinical and short, and communication. Long clinical, communication short, in the same order till the Thursday. So tomorrow will be the short, and it will be chest cases. Anyone interested for chest as short cases, please message me, direct message me, and we will try to do it tomorrow, inshallah. Any question before ending the session?
What was الكحول stop or moderate
And for me, Dr. Tahani, for me, to stop, because either chronic it will affect, and for that for the acute or the binge drinking also it will affect. So
Yes.
why I will be in doubt either to be affected or no. So better to stop it. Anyway, if you are in doubt, refer him to the assigned team or to the pharmacists, because who will take decision? The pharmacist or clinical pharmacist. She will tell you is it affected or no. You can refer to someone who can help in this if you don't know. I'm not sure about information, so refer him to the dietitian, to the pharmacist, to give him clear answer if he raise it, okay? But for me, I would advise the patient to stop alcohol, because any amount of the alcohol might affect the INR, which would be life-threatening for him if it is subtherapeutic or supratherapeutic. We will read again, and we will update in the group after this meeting by a message, okay? I will try to search about it more and more. Clear?
Appreciate it
question?
really, Dr. Bassem, really, regarding the pulmonary embolism treatment, as because it is written, I think, in a remark sheet, the time scale. So better to mention
Okay.
as you told, really. Thank you very much.
Yes. Most welcome, Dr. Ahmed. Most welcome. This is for any question like this, any scenario, PE or the duration for medication you don't know. It's not written. You can give just few months or couple of months or some months, and we will sit with you again to update you. We don't know what will happen later. She might be stopped and switch to another medication. Maybe the warfarin will have complication. So it's daily basis or monthly basis decision, or meeting decision based on. So you can refer to next meeting, or you can tell her for the next meeting we will update you about the duration if you are in doubt.
I searched
Yes.
about this alcohol in
Perfect.
NHS UK. It
Perfect.
is no, not you can drink, but avoid drinking heavily. Just
Okay.
yes.
So you can drink in your limit, right? Like this.
Moderate, but drink
Yeah,
heavily
moderate to your don't exceed the
can
limit.
cause,
Don't exceed the
yes,
limit. Yeah.
and
Okay.
the
Don't
binge
exceed the
all
limit,
and
and
yeah,
yeah, don't take it in the
don't
binge.
drink
Okay.
a lot
As a
at
binge.
one time, at one
Yes,
go.
exactly.
Yes.
Okay. So clear. Perfect. Thank you, Dr. Ash. So let's update it again for all attendants. Any warfarin and patient on alcohol, please, you can moderate the intake not to exceed the limit 14 units per week. Okay. And don't take it as binge drinking. It means taking a lot in once, an event occasionally like that. Okay. If you are not sure about any information, you can refer. Okay, thank you, Dr. Salma. Jazakumullah khairan. Ameen. Any question before ending the session? Okay. Seems satisfied. Thank you, Dr. Ahmed Shata, Dr. Ahmed Abdulakhir. Nice two scenarios. It will help all of us. Thank you, Dr. Aisha, for the comments, and Dr. Salma and others. See you tomorrow, inshallah, with the short clinical day. Good luck and good night.
Yes.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullah. Thank you very much.
Yes, okay.